So here are some items that people have questions about whether or not they are on the NCLEX, and things like nursing specialties, what kind of terminology, keywords, medications, units of measurement, and cognitive level. And NCSBN does go ahead and answer these questions here, although sometimes they're somewhat vague. So, with regard to the specialties, and they basically say it's a computer adaptive test, and items are selected based on the candidate's ability. I can tell you that students do see questions from maternity, ER. They do have those questions because they know that they are in the curriculum and they're not sure where students are going to practice right out of school. So they have to have that minimum safety level, and they do want them to have a basic understanding if they're going to go into a specialty. They answer things like what about the terminology? And NCLEX does try to use terminology, and they're very good at this. They have special committees just for each and every area, such as keywords and culture, just to address all of this. But they try to make sure that the terminology crosses all of our states, so that it's consistent. And then do they bold? They used to not, but they do bold keywords such as best, most, essential first, priority, immediately, highest, initial, next, increase, decreased, and support. So this is good information to have, and you may want to earmark this, and then you can refer students to it as needed, especially towards the end of the curriculum. And then as far as medications, they let you know that the information, the terminology is consistent, and they acknowledge both generic and brand trade names when referring to medications. Students often ask about the need to know list, and NCLEX, NCSBN does not specify a list. They talk about units of measurement, integrated process, and these are things we talked about earlier. What is an integrated process? They consider these fundamental to the practice of nursing. So again, things like the nursing process and culture, spirituality, communication. And then the cognitive levels. We know that they do work up from the Bloom's lower levels to the higher levels. We'll talk about that in a minute here. And so this is great information, and alternative items, that's one that students really want to know about it anymore. The multiple response, fill in the blank, hotspot. They really like the chart exhibit format anymore, so they like to put some of those in there. Ordered responses, so that the students have to rank priority. Audio format, they do have headphones available there. And then graphic options. So this is really excellent to inform us, but what it should also do is when we see these, we do need to make sure that we are incorporating these on tests throughout the curriculum to prepare students so that they're not anxious, and so that they're comfortable with these formats by the time they do reach the NCLEX.